Hello everyone, I am Sneha Vaniyan Chandran, Assistant Professor, Department of Anesthesia and OT Technology, Yenepoya School of Allied Health Sciences under Yenepoya Deemed to be University. So today, I'll be speaking about Bispectral Index monitoring. Specific learning objectives. At the end of this session, the attendees will be able to explain Bispectral Index monitoring and its indications, enumerate the parts of the monitoring system, list the limitations of BIS monitoring. Introduction. Monitoring the depth of anesthesia is very important during any procedure. Anesthesia that is too deep can cause hemodynamic changes, and anesthesia that is too light carries the risk of recall or awareness during anesthesia. Awareness during anesthesia is a very serious complications with potential long-term psychological sequelae such as anxiety and post-traumatic stress disorder. The BIS monitor is the first FDA-approved method to assess the hypnotic effects of drugs. In this picture, we can see that this is the BIS monitoring. There are bispectral index sensors that are kept on the forehead of the patient, and then there is a patient interface cable that is connecting the sensors to the monitor, and then there is a power button on the monitor. In the monitor, we can see that there is a current bispectral index value, real-time EEG, and together it is called as the bispectral index monitor. The BIS represents a significant development in the objective assessment of the depth of anesthesia, providing valuable real-time feedback to anesthesia providers. So the BIS is actually a dimensionless number that ranges from 0 to 100. 0 indicates of complete brain inactivity and 100 indicates of an awake alert patient. Value less than 40 represent a deep hypnotic state. So usually for general anesthesia, we require 40 to 60 BIS value. This will prevent awareness during anesthesia. This number is obtained by analyzing the electroencephalogram of patients undergoing anesthesia. BIS monitoring provides the patient's level of consciousness, improving the ability to tailor anesthetic delivery and avoid unnecessary deep anesthesia or inadvertent awareness during anesthesia. So what are the indications of BIS? Firstly, it is used during general anesthesia monitoring to find the right depth of anesthesia. We can use it for high-risk surgeries like cardiac or major vascular procedures, neurological procedures like awake craniotomies, sedation procedures like endoscopy or any interventional radiology procedures. In ICU also we can use this for sedation monitoring so that we can prevent over or under sedation. Pediatric anesthesia to maintain the anesthesia dosing in children, especially for the drugs. So technique, how will we do this BIS monitoring? BIS monitoring involves the application of 4 electrodes on the forehead. The skin on the forehead is first cleaned with an antiseptic alcohol swab, and then 2 to 5 seconds of digital pressure is applied over the sensor leads so that it stays in place. The sensor is comprised of disposable wet gel electrodes. In pediatric population, if you want to measure the brain activity, a BIS pediatric sensor is also available. You can see in this picture that there is BIS value, and then there is EEG, there is trend values along with the BIS index value. So the BIS view monitor displays BIS number, trend graph of BIS values over time, raw EEG waveforms in real time, various signal quality indicators such as signal quality index and EMG, and alarm indicators as well as messages can be seen on a BIS view monitor. So this is the equipment that we use for BIS monitoring. So then there is BIS sensor, a patient interface cable, BIS X device, on standby button, monitor interface cable, and BIS Vista monitor. This is the BIS value index range. You can see that 100 means it's a complete awake patient who responds to normal voice. 80 responds to loud commands or mild prodding or shaking. 40 to 60 is the one which we require for general anesthesia so that the patient has low probability of explicit recall and also is unresponsive to verbal stimulus. The patient under 40 is in a deep hypnotic state. 20 means that burst suppression and 0 means a flat line EEG. So this is the BIS index range. 40 to 60 is required for general anesthesia so that patient does not recall any of the memories that happened during the anesthetic procedure. So what are the limitations and factors affecting BIS monitoring? First and foremost, it is the anesthetic agents. BIS is unreliable with drugs like ketamine and nitrous oxide, which can affect the electroencephalogram readings. Second is the age. Infants under 6 months, it is hard to use BIS because of their immature brain activity. Third is hypothermia. Lower body temperature causes BIS values to drop. Then in neurological impairment, like patients with brain or spinal cord issues, BIS may not be accurately measured. Then usage of medical devices such as electrosurgical cautery can affect the BIS accuracy. Summary: BIS monitoring is used in operating rooms and ICUs. Maintaining BIS values within the range of 40 to 60 is essential to prevent anesthesia awareness and mitigate the potential long-term psychological consequences. BIS monitoring involves the placement of electrodes on the patient's forehead with the information displayed on the BIS view monitor. So these are my references. Thank you.